Hey guys, Nurse Alyssa here. Today we're going to be discussing Duoderm Extra Thin Hydrocolloid Dressing. But before we get started, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. Duoderm Extra Thin is composed of cellulose, pectin, and gelatin, providing an occlusive, moist environment. So this doesn't have an absorbing effect. It's very occlusive and the moisture stays there. So we wouldn't use this on heavily exudating wounds. You would want it on very minimal exudating wounds. We're going to use the Duoderm for wounds with small amounts of exudate. Or we can use it as a protective dressing for reddened or superficial skin breakdown. And we can also use this as a border dressing around a wound for negative pressure wound therapy. We are not going to use this dressing with wounds that have a moderate to a large amount of exudate. And we're also not going to use it on wounds that are clinically infected. Just like any wound, we're going to first start by cleansing the wound and peri-wound tissue. So you're going to just clean it with normal saline, making sure all the debris is cleared, and you're going to dry the peri-wound very well. So for this dressing, you want to make sure it overlaps the peri-wound intact skin by at least 3 centimeters. The dressing can be cut to fit, but it has to have the overlap for it to stick onto the skin and to work properly. So you're going to peel off the adhesive side. There's a cover over it, so you're going to peel that off, and you're going to place it on the skin and smooth out the edges of the peri-wound, and you're going to hold your hand on it for a few minutes just to warm it up. That's how it really sticks. You have to add warmth to it for it to stick properly. To remove this dressing, you're just going to lift up one of the edges and pull away from the wound. You can use an adhesive remover if needed, but they do come off pretty easy. So the frequency of this dressing change is going to 100% depend on exudate. So the dressing needs to be changed every 5 to 7 days at the maximum. But normally wounds are changed every 2 to 3 days. So the expected outcome of this dressing is that you don't have any peri-wound maceration. We want to make sure that the exudate is managed well, because anytime we have peri-wound maceration, the wound can get larger, and that is the exact opposite of what we're trying to achieve here. That's all I have for today's video. I'll catch you in the next one.